We have incubators, we have ventilators, we have bubble CPAP machines. So these are like specialized equipment basically to cater for your preterm newborn, and we do have them in the country. So in terms of medical equipment,
we're good there.
We're not bad.
Hey guys, welcome back to my channel where we're all about leveling up, elevating, and living our absolute best lives. A part of that is making sure you're healthy, your children are healthy, and everyone in your household is healthy. Today we are interviewing Dr. Shetty, who is a pediatrician who specializes in neonatology, located here in Kampala. She's extremely knowledgeable and works with an amazing crew of other doctors as well at NSK Clinic, which is here off Kira Road in Kampala. I know that a lot of you have inquiries about moving back, especially when you have children, so I figured why not bring a specialist and someone who really knows what they're talking about and who really loves children and just the betterment of them, bring them on the channel to share information with you. All right, guys, so we're here with Dr. Shetty, and I'm so grateful. Thank you so much for taking time out of your busy schedule to educate my followers and subscribers and moms, future moms, and families and all that who have little ones and want to know more about pediatrics in Uganda. So if you tell us a little bit about yourself and your background.
Well, firstly, thank you so much, Rachel, for having me here. I think it's very important for everybody out there to know what pediatrics is exactly, and when exactly we come into the picture.
Yes.
I think there's a lot of when it comes to pediatrics, there are a lot of question marks, because a lot of mothers think that pediatrics is for sick children, which of course it is.
Right.
We're definitely there for sick children, but more than that, we're there for the well-being of the child.
Right.
We just want to make sure that children are growing well, they're achieving their neurodevelopmental milestones, and just monitoring their growth process and vaccination.
How long have you been practicing, and how has it been starting your practice here in Uganda?
So I graduated in 2016, did my specialization in 2017, and I started, so you know, when it comes to med school,
yes,
we really start practicing way before, because for us studying is practicals and practicing. Exactly. So I mean, if we see it that way, it's been 12 years since I've been practicing. But after graduation, I started in 2018, so about 4 to 5 years.
Okay. And how has it been, specifically in the pediatrics department, as a doctor in Uganda?
I believe we have wonderful pediatricians in Uganda. We have an abundant base of knowledge among pediatricians. But there is a gap between pediatricians and mothers. And yes, because mothers don't know when they should approach pediatricians, and pediatricians, we are only in contact with mothers with sick children. And you know, at that point, we can't really talk about the well-being of their kid when the child is sick. So because of that gap, I find we miss out on a lot of opportunities where we can talk to parents or even guardians about it.
Okay, so my quick question, just because I'm thinking, I have very young sisters, so my youngest, when she was born, I was 15, so I was very aware of like the process and everything when my mom was pregnant and then had my sister. So I feel like when the hospital, when you're giving birth, is an immediate contact for where they're giving you like brochures and information about these professionals. Is that a thing that happens for mothers here, or is it just maybe they don't see it as a necessity, so they kind of like skim past and they're like, oh, okay, I'll get to that point if my child is sick?
Exactly, as you said. I feel you should meet your pediatrician even before your baby is born.
Yeah.
Like imagine going to the hospital and everything is new for you. The experience is new. Even if you're a mother for a second time, the experience is going to be different each time.
Right.
So when you're going into the hospital, it's a new experience for you, new people around you. Wouldn't you feel comfortable knowing that, oh, my pediatrician is going to be there? That means my baby is going to be taken care of.
Right.
So you're already at ease. And you know that if, God forbid, anything happens, but if it is to happen, you do know that, okay, I've got my pediatrician there, and she's there or he's there to take care of my baby.
Exactly.
I think that's really comforting for any family, and more so for the mother.
Right.
So I believe the first visit to your pediatrician should be even before, should be during your antenatal care.
So funny hearing a little bit about your journey through medical school, your family, because I thought it was very different than what I would assume most people were like, oh, my children and being a doctor. If you could go a little bit about that, because I think it'd be really funny for them to hear.
Yeah, sure. So my story of going into medical school, I feel, is everybody has their stories. Mine is a little bit different, because when I first told my dad that I wanted to become a doctor or I want to go into medical school, his first response was like, why? Why do you want to go into med school? Why do you want to spend 10 years of your life studying something? And he was like, no, do something shorter, like do something that's only going to be like 2 or 3 years of studying and then you're out of it and you're done.
In the working world.
Yeah. And start working early. So I was like, no, I don't think that's my calling. And so even when I was, when I got through med school and it was the day to pay the fees and the hostel, he's like, are you really doing this? Like, are you really going into med school? I'm like, yeah, I'm doing it, Dad. And the funniest part was, even after my 5.5 years of undergraduation, so we have 5.5 years of undergraduation, and then we have 3 years of specialization, and 1 to 2 years of super specialization. So when I did my 5.5 years of undergraduation, I came back home, I graduated, and I was like, okay, now I want to specialize. So he's like, what? Like,
I thought we were done here.
Like, we're done. Like, now you're done with your hobby. Can we get down to business? So I was like, no, this isn't my hobby. This is
my passion.
This is my future. So even when I told him I wanted to do my specialization, he was taken aback. But now, obviously, when he sees me working and when he sees how I work, so obviously he's come round it. And but I truly believe, no matter what it is, whether it's med school, whether it's any profession you want to do, and there is resistance in the family or somebody who questions you, I think if you believe it, you just go through it and go ahead and do it, and you should be fine.
So now getting into children and like visits. So for parents looking to live in Uganda, could you share some of the common reasons why most children are coming into the clinic versus, say, abroad? Because obviously different climates, different areas of the world, maybe there's some different things, perhaps.
Yeah. So I felt one of the biggest difference in pediatrics in Uganda as compared to anywhere else that I practiced was there are a lot of parents who wait for their child to fall ill. And I would prefer parents coming to me or guardians coming to me at every vaccination visit. So I believe there's a system where people or the parents just come in for vaccinations, they get it done, and they go. But I feel that's a very crucial point, and that's a good point to come and visit your pediatrician, because this is the time you get to discuss about not only vaccinations, the growth of your child, the nutrition of your child, habits, like child behavior, like what are the kinds of things you can do to motivate, to encourage your child. A lot of these days we're seeing a lot of speech delays because because of COVID. So there have not been so much interactions
with other children and other people generally.
Exactly.
Oh wow.
Yeah. So why do you want to wait till your child is 3 or 4 years old and not speaking a word?
Yes.
And yet you can come in touch with your pediatrician way before, maybe like 1 year, 1.5 years, and they'll give you tips on, okay, maybe you should do this. Maybe now you should meet a speech therapist.
Right.
So we are proactive about it. So I feel we are yet to develop a culture where we are proactive rather than we just wait for things to happen.
Okay, that makes sense. So now if we actually can talk a little bit about that, children with maybe more developmental needs, is there a lot of support, or is there support within the doctors and within just the medical field in Uganda for children with developmental needs?
So there is support. I don't know if there is enough support. I think there's so many children, and I feel the autistic spectrum disorder has got such, if I may say, a bad name.
Yes.
But actually, it's not really. So we have mild, moderate, and severe.
Yeah, it's a spectrum.
Yeah, it's a spectrum. Exactly, the word as it says, it's a spectrum. And 80% of these children are usually mild to moderate. It's only 20% that are severe. So in these 80%, if they go to the right occupational therapist or speech therapist, most of the times these children get better.
Yes,
But then as soon as, even as a pediatrician, I use the word autism, it's almost like
not my child.
Yeah. So I feel, again, like a lot of these like behavioral disorders, autistic spectrum disorders, speech delay, I feel we should become more broad-minded about it, listen to what pediatricians say, but also question your doctor. Like, I would rather have a mother who would ask me 10 questions rather than stay silent, go home and ponder, and then Google it.
Oh, yes.
I mean, I'm sitting right here. Please ask me.
And as a person who overly WebMDs, you just get overwhelmed and scared, and you start to it's just information overload on Google. So it's much better, obviously, with a professional.
Yes.
We need to stop doing that as well. Okay, so touching on the professionals, what professionals do? This is for people who obviously are also interested in maybe moving, and maybe they're in their certain careers when it comes to children in the medical field. What professions do you feel like we do need some more professionals in for children when it comes to children?
I think the occupational therapist, speech therapist is definitely we require more of. I believe any child, any hospital that has a children's clinic or a children's specialty should definitely provide services of occupational therapy, speech therapy, and what we have right now in our country is appointment based, and it's usually this one speech therapist that's visiting 10 hospitals.
That's so overwhelming.
It is overwhelming for the doctor, it's overwhelming for the patient, it's overwhelming for the child. So yeah, we require a lot of these specializations that are probably not known as yet, but we definitely require them.
Right, No, that's good to know, especially because even a year ago I met a lady who was doing, I hope she also is watching, she's in therapy, there is a therapist for children, and she was just moving back, so she was trying to find her footing and figure things out. And I was literally like, I wish I could give you like more information or connect you with people so you can figure out where to place yourself, because it's needed. All of these professions are needed. So I think the number one concern a lot of people have with moving, especially, and just relocating or living in Uganda, even just generally, who are having children, but even if you've lived here, is just the routine for your child, especially once you've now given birth. So are all vaccines available that are like mandatory abroad or wherever worldwide? Are they all available here? Are they consistently available? Is it affordable for a mother Yeah.
Yeah. So vaccinations are definitely available over here. Most of the pediatricians follow the Ugandan vaccination schedule.
Okay,
So all of us, we follow the Ugandan vaccination schedule. But of course, some of us also implement the CDC guidelines for East Africa.
Okay.
So that if you're an expat that's traveling to and fro from the country or other parts of the world, we definitely cover the international vaccination schedule as well. So that, and also children who study here, I mean, who've lived here and study here, for example, me, and then we go out to study in other countries, they have a criteria. You need to be vaccinated for so-and-so diseases. So we make sure the child is covered before they even go into university.
Oh, amazing. Okay.
Yeah.
Okay, because I know that was one of the questions that a lot of people had asked and were concerned about. And I'm like, I'm pretty sure you can get everything as long as you go to the right place and have the doctor. Okay. And then how are emergencies handled when it comes to children? Especially say for yourself, if it's your patient. Yeah, how are emergencies handled?
So again, during these wellness visits is first a mother needs to know what are the emergencies.
Right. Good point.
So, because I mean, fever is scary, and a child having fever is scary, but it's not a medical emergency. It's something you can manage at home, like give a medicine to the child to bring down the fever, and then of course visit your doctor.
Right.
So when you have these visits, we can tell you, okay, now this, like if it's an allergic reaction with a rash, then you can give like an anti-allergic syrup at home and then visit your pediatrician. But if it's an allergic reaction that's having difficulty in breathing, there's swelling all over the face, then you go to the emergency department. So again, like, exactly, there's so much information because, you know, babies can't talk. Children can't, they can talk, but sometimes they can't really express what they're feeling. Whereas as an adult, I can tell you, this does not feel right. Let's go to the emergency. But a child won't be able to do that. So when that's happening, it's really important for us to tell parents when is the time that you should go to an emergency. Because there is, I mean, if a child is spiking fevers in the middle of the night, you're not going to pick up the child and run to an emergency. That's scary for you and the child. So you'd rather manage it at home and then ask doctors, okay, what are the dosing? How do I give it? How often? Till I come and visit you the next time. Yeah.
Okay, no, I'm just laughing because I literally, if I were a new mom and I didn't hear that, my first thought would have been like, Auntie Pizza, okay, call the pediatrician. There's a fever.
I understand.
I have so much respect for mothers.
I completely understand. And I completely understand a mother doing that because they're just trying to do their best. And so them doing such a thing is not unusual. But of course, these are the things you should be discussing with your pediatrician.
100%. Oh God, no, I'm going to be the worst mom. Oh my God.
Not at all.
Okay, so just a little bit about your practice specifically as a pediatrician. What made you decide to be a pediatrician in Uganda versus the other places? Could have been the UK, US, everywhere where you did your studies.
Uganda is very close to my heart. I was raised, I was born in Tanzania and I moved here when I was 5 years and been here since then, since I was 17, and that's when I went to med school. Even when I was leaving Uganda, I was sure about one thing, is that I'm gonna come back to this country. I didn't know when, I didn't know at what point in my life, but I had to come back to this country and give back something of what it gave me.
Oh, I love that.
This country gave me so many opportunities, so many things that, so where I am today is definitely because of Uganda. The education I received here, the colleagues I met over here, the friends I made over here, it is where I am today. So it only makes sense for me to come back and give back something that this country gave me.
You said it so like easily and so like obviously, Whereas I feel like so many people really wrestle with that decision. So that's beautiful. I love that.
Thank you.
So how was specifically your first year practicing in Uganda? Now having to start up something, I start up a business. I also practice your passion.
Yeah.
Yeah.
It was definitely a challenge, Rachel. And I'll be honest, there were some instances where I really thought that I was gonna leave and go back.
Right.
At some point, it seemed impossible for me to start my practice, because I mean, yes, you want to serve people, but you also want to be self-sustained. You want to be independent, and I mean, this is what I keep telling people, like, you will not see a doctor on Forbes magazine because it's not our aim.
Yes.
We don't want to be on Forbes magazine.
Right, that's not the goal.
We're really here to help our patients and help people who come to us. But of course, we need to be self-independent. We have our families. We need to be self-sustainable. So we have all of those needs. It's just that I feel people think that, that sometimes, I mean, I wouldn't even say that it's a business. I think it's a service that we want to provide to people. But of course, I have people who work in the clinic alongside with me. I've got people who support that I can sit here and attend to my patient. So I need to cater for their needs as well. So I feel as a clinic, we want to say our aim is to make patients their needs our priority.
So what are some of the pros and cons you've experienced practicing in Uganda?
Pros is definitely the patients. I think I've got the most wonderful patients. I love seeing my patients. I wake up in the morning for my patients. So yes, the kids, the parents, the grandparents. I love it when it's like a mini family reunion in my office with the granny, with the mom, the dad, and the child. It's always a pleasure to meet the family. I always believe pediatricians are like an extended family member, like a part of the family. So it's very nice. I think that's the best part of my job. Cons, I would say it's, as you said, the lack of some specializations in our fields. There's sometimes you feel helpless because it's not your area of specialization. You want to help your patient, but there's just so much you can do. Yeah, and then you're almost stuck, like you don't know where or how to advise them from that way forward.
Very hard.
Yes. Actually. So as, like, for example, if you compare a clinic and a hospital, a hospital would have all specializations like pediatric dentist, pediatric neurology, pediatric gastroenterology, pediatric endocrinology.
Oh, wow.
So you have, so there's a whole lot of specializations. So like mine is neonatology. I basically deal with newborn children and preterm children, babies. So, but when you're in a clinic setting, you don't have that kind of specialization. But having said that, there is no children's hospital in the country.
Oh, anyway, I was going to ask that later, but okay.
Right. So there is not a hospital that you can go and your child will get all the services. And if you go to other countries, you'll have specifically children's hospitals.
And that's what we're so used to since we were kids, knowing there's Sick Kids Hospital in Toronto. And like everybody always knew. Okay, wow. Okay, that's very interesting. So what advantages do you feel like we have as a country in pediatrics? Or even just, I guess, for children and babies?
I think we have excellent pediatricians in the country. So it is on us to get together and make this pediatric hospital happen, because we do have even super specialists. So we have neonatologists, we have pediatric nephrologists, those are kidney specialists. We even have pediatric neurologists that's for the brain. So we do have some specializations.
Okay.
So it's really on the pediatricians to come together and make it happen.
Okay, that makes a lot of sense
Yes.
then. Okay. Because I was thinking maybe from a mother's perspective, they're like, oh my God, if anything happens, then it's not possible for my child. But they're there. Okay, it's good to know they're there.
Yes, they're there.
So if you're not able, if you yourself are not available and you're out of country, are there alternative pediatricians that you recommend, that you do work alongside, that you're like, okay, they can cover? How does that work?
Yeah, for sure. So when I'm not in the country, I will I will inform the doctors that I'm leaving the country.
Okay.
If my patients come to you, I'll be giving them your address or your phone number. So I inform the doctor and I inform my patients as well.
Okay.
Sometimes they're not emergencies. So what happens is when they come into the clinic, they say they specifically want to speak to me.
Right.
So I asked my clinic, I always keep notes of the patient visits.
Okay.
So I'll just ask the clinic to send me the clinical note, like the past notes of the child.
Right.
And then depending on that, if it's something I can manage over the phone, then I shall manage it over the phone. But if I feel like, no, this is something that a pediatrician has to see and evaluate the child, then I'll refer the child.
Okay, good to know. And just for a side note, she literally doesn't take any days off. She works 7 days a week and she's always here. But I know some moms might also be concerned that you never know. So
Yeah.
Good to answer. Okay, perfect. Okay, so we're going to get into a little bit more about the clinic and how it works as a patient, as a child. So if you could talk to us a little bit about the typical visit for your patients. Yeah.
Okay, so we have 2 types of visits.
Okay.
We have the wellness visit
okay.
and we have the sick child visit.
Oh, okay.
You can make an appointment for either one on any of the days. So typically for a well visit, like a well child visit, it would be they register at the reception.
Okay.
We take their vitals and their anthropometry, so that's their weight, their height, their head circumference. And then they come into my office and I plot their growth charts. We briefly touch on nutrition. Then we discuss about vaccinations. I ask the parents whether they have any questions regarding the vaccinations. There's some vaccinations that some parents are always usually very skeptical about.
Yes.
So I try and keep an open mind and answer to the best of my knowledge on those questions that they have. I would rather a mother feel comfortable of what exactly the child is getting rather than not get it at all or get it and then be like, oh my God, what if my child has a reaction? What if this person was telling me this reaction or this adverse effect of the vaccination? So rather than have those doubts, we clear it at the wellness visit. And then I also tell them when is the next date for the wellness visit. When a sick child comes into the clinic, they go through the same process where they do the registration. We check the vitals. We may not check the head circumference, for example, because we just have a look at the weight because the child is sick. We don't want them to undergo unnecessary anthropometry at that point. Have a look at the child, do a clinical examination. If labs are required, I may ask for labs. Typically, if I feel it's just something that they can wait and watch, then I will ask them to wait and watch. If medications are required, I'll give the medications. And if I feel the child will require follow-up, then I will give them a follow-up date.
Okay, that makes a lot of sense. Very thorough. And it's always the same, so the mother's comfortable, the parents are comfortable, everyone's comfortable. Absolutely. So what services can you touch on that the clinic itself provides?
Yeah. So we have a multi-speciality clinic. At the clinic, we do have pediatrics, well baby check. We have vaccinations. We have nebulizations for the child. We have lab tests, so we have a laboratory. We have a pharmacy. I am very strict about some of the things that come into my pharmacies.
I like that.
Yes, so there's some molecules which are not FDA approved or which have not been researched on children. Those molecules are not allowed at the pharmacy.
Oh, that's very good.
Yes.
I didn't even know that was a thing.
Yes, because I know there's a lot of over-the-counter culture in Uganda.
Yes. A lot of things where I'm like, I need a doctor's prescription for.
Exactly. Because it is something that's happening and an instinct. Mostly people over here will go to their pharmacy, just give me something for a cough, and they give it to
we're all on WebMD thinking we're doctors. Yes.
Exactly. Because these are children, because there's some molecules we don't give to children, and because there's an over-the-counter culture over here, that's why in my pharmacy, I will not allow.
I love that. And I like that it's a one-stop shop, essentially, that's saying, where you literally can come in, get everything you need, and go. You're not running around to God knows what pharmacies or God knows where else.
Yeah.
You get everything. That's really amazing. Okay.
And we also have a dentist. We
that.
have an orthopedic physiotherapist.
Okay.
We have an internal medicine, and we have a cardiologist.
Yeah.
And we also have an obs gynae.
Oh, wow. Okay. Yes. So it's really a lot of, everyone in the family can make sure they get covered when they come in, which I think is really amazing.
Yes.
Okay. So now for yourself, are house calls an option?
That's a very important question, I feel. Personally, I don't do house calls, and I'll tell you why. Because there's some things I will require, like I may require like an oxygen saturation. I will require maybe a BP apparatus. I may require some specific instruments to do some tests. And as an instinct, we sometimes don't carry around. But in a clinical setting, we have everything around us for evaluation. And also I feel like if I want to do a lab test, I can send them for a lab test or start them on a medication right away or start them on a treatment right away. But in a house, I won't be able to do that. And also when it comes to children, it's a bit more delicate. As adults, we can still do house visits because you are able to tell your doctor that I'm feeling this is what's happening to me. But when it comes to a child, because they're not able to vocalize or express what they're feeling, it's always better for them to come into the emergency or the clinic for an evaluation rather to wait for a doctor to come.
Okay, that makes a lot of sense.
And with Kampala traffic.
Yes. You'll be running around and you only see 2 patients a day. When it comes to insurance, because I know, like, for example, for me coming from Canada, I would never even have to ask about insurance. Like, I really never cared because it was universal. But obviously now coming to Uganda, people have to purchase their own insurance and all. How does that work for your child? Do you guys accept it? Are they under that?
So I think mostly you have to talk to your insurance providers because it's not natural over here. You have to specifically ask your insurance providers whether your child would be included in the insurance. Some of the insurance providers will include your child for the first three days of their life, and then after that you have to pay. So these are some of the things that may not be told to you overtly, but it's something that you will have to ask your insurance providers. So some insurances, they provide for children, some don't. So I think it's very crucial to ask those questions.
Yes, and to talk to them. Okay. And then lastly, about the visits, what should a parent bring and how should they prepare for their first visit and just visits for when they bring their children in?
So I always tell their mothers to keep a note of all the questions they have on their phone, on their notes, so that when you're sitting in front of your doctor, you're not like, oh, what is it that I wanted to ask? You just open your phone and you can ask your questions. In terms of what you need to bring is the birth history of your child, your antenatal history, and any other medical records that you have about your child or you specifically. So these are the most important things that I ask for usually. Even if you don't come with it on your first visit, I usually ask you on your next follow-up, just bring them along so that we can put it into our system as well.
And just stay super organized for your child, which is so important.
Yes.
Okay, so just wrapping up our video, and you've been so informative. I'm learning, I feel like I met you twice already, but I've learned from the first time, then the second time too, I'm like, wow. But anyway, so we already touched up really upon the medical professionals that we're lacking within Uganda, but I would ask about in just general, even outside of just children, just for people who might be interested, in having, So
To be honest, what Uganda was in terms of medical facilities 20 years ago, it's really different now. And I feel we have so much more specializations that are available, but people are not aware of it.
Okay.
Like I remember 20, 30 years ago, like when I was a child over here, I would hear people get heart attacks and fly them to another country, like
oh my gosh.
an air ambulance. I would like people to know that you don't have to do that anymore.
Right.
We do have facilities in the country. We do have interventional cardiologists in the country that cater for these emergencies. So I think it's very important for you to know what facilities are available in the country before you take such a huge decision of flying to another country in a medical emergency.
Right.
So yes, I feel today what we are in terms of medical facility in Uganda, we are much better off than what we were 20 years ago.
Okay.
But we also have a long
way to go.
And cater for a lot of needs of the population. But yeah, I think we're on a good path.
Yeah, we're on the way there.
Yeah, we're there.
When it comes to things like equipment and I don't know the proper medical terminology, but like yes, equipment and such. Is there an improvement, or is there areas that we just maybe need to basically get a little bit better at?
No, I think in terms of medical equipment as well, we're doing really well.
See?
Yeah, we are.
I had to hear it from a doctor.
I will speak specifically for neonatology as well. So the NICUs, these are known as neonatology and neonatal intensive care units. So we have incubators, we have ventilators, we have bubble CPAP machines. So these are like specialized equipment basically to cater for your preterm newborn, and we do have them in the country. So in terms of medical equipment,
we're good there.
We're not bad. We can manage like extremely small preterm babies. So I mean there are hospitals we've been managing 25 weekers. So these are like barely like 600 grammars, 700 grammars. So extreme preterm and extreme low birth weight babies. So we definitely we do have it. Of course, I mean, I'm never going to compare it to standards of other countries
that were started a lot earlier. Yeah, we cannot compare, but at least it's known that it's there. Okay, that's good to know. I know it's. I'm still learning about the different professionals in the medical field, but I know when my friends had children, and some of them had their children abroad, but then COVID happened, and then they had to have their children here, they said their experiences were amazing, and all we ever heard growing up were horror stories. So it's so nice and refreshing to hear that it's possible. Everything is possible, and that's what's important.
True.
Okay. So last few questions. What is the best way for parents to get information on how to successfully raise their children?
That's a very interesting question. I feel a lot of this come from grandparents and uncles and aunties over here. But I also think include pediatricians in this and your doctors as well. So maybe, I've heard a lot of non-medical advices. Like, when a child comes with constipation, I've heard just apply tomato juice. In the area. Yes. So
who cannot digest?
Yes, exactly. So I mean, I would say you can listen to these things, don't apply them, speak to your pediatrician, and if they say it is fine, it's okay. But generally I would say talk to your doctors about it.
Very smart. If you could just let everybody know a little bit about like where the clinic is, just the general information where they can find.
Sure. So we are NSK Children and Cardiology Clinic. You'll find us on Kira Road. We are right opposite the Uganda Museum in Uganda Cares building on the ground floor.
All right, and then very last question, how can future moms, future parents, or current moms and current parents reach you?
I'm very easily accessible.
I love that, actually.
I'm always here at the clinic, at NSK Clinic, and they can just call the reception and just call to book an appointment. I also have an Instagram page. I'm not very active, I will be honest.
But it's informative, and
yes.
that's what's very important.
Thank you, Rachel. But if you ever want to get in touch with me, I definitely read the messages, the DMs, and I reply to them. So that's another way of getting in touch with me.
Amazing. Thank you so much, so much for sharing your time with us and all your information, guys. Like she said, NSK Clinic, it's not very far. I know it's actually, sorry, in town. It's not far at all. I was going to say it's very easily accessible. So please go check out her Instagram. I'll leave all the information down below. And as always, please do remember to subscribe, hit the bell notification button, and leave a comment below. Any questions that you have, I'll gladly share them with her as well, and hopefully I can answer them in the best way possible. But please come and book an appointment. Other than that, thank you guys so much for watching, and I'll check you guys in the next video. Bye, guys.